You fell on the fence?
Oh my God.
It was extremely deep in the tissue. We all had a lot of trauma experience, and none of us had ever seen anything like this before in our careers.
ER physician Dr. Britt Durham had seen it all, but nothing prepared him for the case that came through the door one fateful afternoon. A 15-year-old girl, Dakota, who had suffered a severe neck injury from a fence at a BMX park. The chances of survival for a patient with penetrating neck trauma were slim. The neck houses two many vital structures: windpipe, arteries, veins, and the spinal cord, making survival unlikely. As Dr. Durham awaited the patient's arrival, he braced for the worst. When Dakota finally arrived, he couldn't believe his eyes. She was still alive and able to talk. The fence had pierced her neck deeply, and the stakes were still lodged in her skin. There was too much risk of pulling them out, as it could cause severe bleeding. The first surprise was that Dakota wasn't in the state of distress he had expected. She wasn't being ventilated, nor was CPR being performed. She was conscious, talking, and asking about her mom. The injury, although extreme, didn't seem to have caused immediate life-threatening damage. However, Dakota was in severe pain and afraid of being paralyzed, as she could feel the pressure on her spine. Dr. Durham was faced with the difficult decision of how to manage her injury, especially since she was still alert and they needed to prevent further damage. They had to stabilize her as quickly as possible before transporting her to the operating room. But complications started to emerge. The injury affected Dakota's ability to breathe properly, and blood began to pool in her mouth, complicating the situation.